Hello and welcome to Talk the Walk. I'm Azam Khan. Last month, Hong Kong's Secretary for Health, Professor Lo Chung-Mao, released a primary healthcare blueprint for Hong Kong, outlining areas to strengthen the city's healthcare services to residents, particularly those with chronic illnesses, which authorities expect to grow from the current 2.2 million to 3 million people by 2039. The blueprint is a welcoming initiative taken on by the government, which aims at relieving the burden on public hospitals by shifting the focus from treatment to prevention of illnesses. However, just how efficient and realistic is the new scheme, and does it properly address the needs of the underprivileged? My guest today, to unpack the topic, is the director of the Sutong Shanghai-Hong Kong Economic Policy Research Institute at Lingnan University, Professor Ho Lok-sang. Professor, thank you so much for taking the time to speak with me.
Thank you for your invitation.
When the government released this blueprint last month, what were your initial thoughts on it?
Well, I think it's a great idea. As a matter of fact, unfortunately, primary care is an area which is very important, and yet our resources are mostly devoted to hospital care, and I think it's not very efficient because we can do a lot better in primary care.
Right. What made the government prioritize primary healthcare specifically? Were the things in mind, perhaps the number of people who are expected to have chronic illnesses in the coming years?
Well, yes. First of all, the background is that we have a very serious aging problem, and the queues, for a lot of the services, specialist services especially, has become longer and longer, and it's very difficult, for people, especially in some underprivileged areas such as Tuen Mun, which is where Lingnan University is located, to get the specialist care that they need. But as a matter of fact, if they had better primary care in the first place, many of these people could have avoided the need, for this specialist care, because a lot of them have chronic illnesses which could have been prevented early on, if they had available to them a better primary care in the first place.
Right. So is this a rabbit hole now that it's difficult to reverse, is what you're saying? Or do you think it's something that should be fully focused on, this transition to prevention?
Yeah. First of all, as a matter of fact, if you look at the basic data, it does seem to be pretty good, because Hong Kong has, as a matter of fact, the world's longest longevity. We actually surpassed Japan a few years ago. So we have the world's longest life expectancy, and it's on surface it's very good. But our elderly, especially the elderly, is highly dependent on this very expensive specialist care. And when the chronic problems have arisen, it's becoming a very difficult burden, for the Hong Kong SAR to face. So we need a way out, and as a matter of fact, we have fairly serious fiscal pressures, and we need to find a way out. And that is why I believe Professor Lo has come up with this idea. It's an idea that had been talked about for a long time, but no serious action has been taken. I think this is a breakthrough.
Right. How much did the pandemic time obviously help to shape and realize the particular need for strengthening primary health care?
Well, during the pandemic, unfortunately, a lot of those people who are suffering from various chronic illnesses actually were denied care, because they even, a lot of the clinics may not be open, and sometimes even early on booked appointments for surgery and whatever has been postponed indefinitely, and so it has been extremely difficult, and that is why if we have done better in preventive care. And I think the quality of life of many of these people could have been improved. And I'm in particular very concerned about dental care. Dental care is an important part of primary care and a very important part of a person's well-being. Imagine an elderly person who can hardly eat, because they have lost the teeth, and they're suffering from pain. And there's a Chinese saying that a pain, from teeth problems could be worse than a serious illness. So
Right.
unfortunately, we hardly have much dental care uh, for for Hong Kong's public. We only have dental care plans, publicly funded dental plans for school children, but not even for the elderly. We have very rudimentary or very crude dental care for the elderly, and it's very difficult to get appointments, and the coverage of service is extremely limited.
That's quite interesting. You mentioned dental plan. That's not something you necessarily hear in the forefront of the priorities. Is there a reason that you think that perhaps why it's often just overlooked?
Well, um, I have heard complaints from elderly people, and they have uh, uh, phoned into RTHK and other phoned in media to voice their problems. And it is an area that, in fact, Hong Kong should be proud of, because we have, our University of Hong Kong Dental's um, the dentistry department is extremely highly ranked. If it's not number two, it's number three. It's one of the three, top three. And yet our dental care for our public is extremely limited, and that's very unfortunate. I know it's
Right.
expensive, but it's still something that matters a lot to people's welfare.
Right. Obviously, do you think there'll be more blueprints and more reforms, for lack of a better word, to come? That for now, this blueprint was a very clever way of sort of dealing with, as you mentioned, the fiscal strains that's been brought about in
Yeah,
the last two
yeah.
years.
I think that the government obviously understands the fiscal pressures, and if if the government were to take responsibility for the entire burden, it wouldn't be possible, for the government to do a very good job. So the government has to work with the private sector, and that is why this primary care idea actually involves private doctors participating. So it's very much like the cataract plan, that has proven very successful. So the government would chip in with some funds, and those people who cannot wait, they can get private dental care. Sorry, surgery for cataract with some doctors, and they will pay the partners on top of the government funding, that is paid to the um, to the doctors.
Right. What do you say to some people have replied, critics have replied back saying that this focus is mainly on those who are better off financially, and thus it creates a disparity, so to say, and there's a
Um,
hope for a trickle down.
yeah, I think in part the government is hoping that this plan enlisting maybe 4,000 or 5,000 doctors, in the private sector to serve as the listed family doctors, that will serve in the public, that will release the pressures from public clinics, and the public clinics can continue to serve those people who cannot afford that plan. But having said that, I am hoping that the fees that will be charged, by the family doctors
Mm.
will not be excessive, and and I hope that they will be very transparent so people can compare. I understand the government had initially this idea of funding half uh, of the cost of these clinic visits. But it has been pointed out that some doctors charge more, some doctors charge less. So the idea of paying for half the cost is not really realistic, unless you're talking about half of a standard fee. And I think that is the way we have to go. We have a standard fee that is to be charged, and it has to be very transparent. And then doctors who charge extra, they also should make the fees transparent. And I am hoping that all these fees will be listed in some government website so that people can compare and can go to the clinics that they can afford. You mentioned about affordability, and I was going to say that I had this plan for putting a ceiling on the maximum amount that Hong Kong, each individual has to pay per year. So if you have a ceiling beyond which the government will chip in whatever resources is needed, for this basic care, then I think the affordability issue can be largely addressed, because each person will know that, well, I need to pay no more than this amount for me for each year. And I think that's important. And apart from that, I would also say that for people with smaller budgets, they can have a lower ceiling so that the yearly budget on basic healthcare can be smaller. So we can make some provisions, to make sure that even low-income people can afford, these various private primary care or family doctors.
Professor, I'm going to pause you there for just a moment while we step away for a break. Don't go anywhere. We'll be right back with Professor Ho Lok-sang. Stay tuned. Welcome back to Talk the Walk. I'm speaking with Professor Ho Lok-sang, Director of the Sutong Shanghai-Hong Kong Economic Policy Research Institute at Lingnan University. Professor, I wanted to ask you about this blueprint, and there was a focus on community-based sort of approach towards healthcare, including the family doctor for all, as well as just sort of empowering district to be able to provide the services with from their centers. So what was your thoughts and take on the community-based approach and its nuances?
Yeah, the idea is that accessibility is a very important issue. And as I pointed out, traditionally, the different districts of Hong Kong, the kind of services that people get are not exactly the same. And there's some kind of disparity, because in some cases the queues are much longer than in some other locations. And I think in particular for primary care, it's very important for accessibility to be more equal. So the idea is of having a large network of family doctors in each of the districts, So that's very important for accessibility. Geographical accessibility as well as financial accessibility, both are important. So this involvement of the community, when the idea comes up, I'm hoping that the community leaders in each of the districts will take part, in encouraging more participation among potential doctors.
Professor, you've done a lot of research in your past on well-being and happiness through university research and whatnot over the last number of years. And when we talk about prevention, I think that's like the ultimate prevention that that for
Yes.
society that can be done.
Yes.
Particularly after the hardship of the last few years, and this doesn't just apply to Hong Kong. This is worldwide. During the pandemic. So, what are some, just from your perspective, what are some policy focuses that you would like to see to help improve the well-being and happiness in practical ways?
Yes. Yes. As a matter of fact, as you know, family violence, domestic violence is a problem that also leads to higher health care costs. You know, mental stress is a problem that could arise from domestic violence, and that has to do with anxiety that people within the family cannot deal with on their own. And that is why I think we do need much better support, for especially parental education. Because within a family, parents' role is very important. And if you're talking about preventive care, if the parents know how to take care of the children,
That's the first
a
line
lot
of
of problems
defense.
can be addressed, can be prevented in the first place.
That's the first line of defense, is what you're saying, right? Like for
Exactly.
every child.
Yes.
So,
Yes, and I would like to add the point, over the longer term, and I'm hoping that parenting education can start in schools, among students. I've been talking about life education. It's very important, for young people to learn how to take care of themselves and how to take care of how to deal with the challenging situations through the lives. And as part of that life education, both education and parenting education are very important because if they know parenting education, because they learn it, from the university or from the high school, I think that's much better chance than if you start trying to do parenting education when the parents are already in a job market. They may not be able to find the time to do it, and you will miss a lot of parents who would need parenting education. That's why I think parenting educations have to start in schools. Then you
your
won't miss
right.
anything.
Yeah, your extensive research on this through the surveys also included the focus on youth, the happiness of youth in the city. And this is some
Right.
years back, so I'm just real quick. I'm curious as to wonder how that compares now. Is it largely similar sorts of things that are on the minds of the youth in terms of for their well-being and their stress, so to speak?
Well, a very important element in life education is the nurturing of what I call mental capital, which is the mental capacity to deal with different situations, different challenges in life. And that really is based on nurturing of what I call mental habits. There are a lot of habits that need to be accumulated, built up, and then when the time comes, then you will have the ability to deal with them. And and I think once you've got that, then when the situation changes and challenging situation comes up, you will be able to know how to deal with it. So when people cannot deal with the situation, usually it's because they don't have the mental capacity to do it, which is actually something that can be acquired, can be learned. And unfortunately, these days we know that even teachers are not well equipped. And some of the teachers run into problems themselves, and so how can they set a good example for the students? And that is why am I hope that all teachers will have mandatory life education that will help them build up the mental capital, which can help them to guide their students.
Right, that's really interesting. But sometimes, as you know, the reality is sometimes families are not even well equipped enough due to the strains that
Right.
they have on them. So that's when
Yes.
community building and community enhancing to protect, to help support
Right.
them
Right.
comes into hand. So what are some ways that
Right.
can be better enhanced and better
Uh,
strengthened?
Yeah, a lot of times it's during trying times that people know that they have the shortfall. and then they need to work hard and correctly, to build up what is necessary so that in the future they can meet their challenges. I hope that these two important groups of people, one is the teachers and the other one is the parents, because they are really on the front line, because they're nurturing our kids.
Right.
And all the teachers are the ones who should be in a position to know the problems of the students. And actually, I had this concern, because we had this policy of at least one social worker per school. And then I was worried that teachers will tell themselves that, well, whenever there's a problem, let me refer to the social worker or something like that, And that is not the way. That's not the way to go, because the teachers interact with students a lot in the classroom and outside the classroom often,
Right.
and because of that, they are aware of they should be aware of the problems of the students, and they are the ones who can earn the trust of the students. So when the students have a problem, they can help. So it is these people who are in a position to help, sometimes even more than the professionally trained social worker. But the first line, as I said, is that these teachers need that training, the basic training, to deal with those problems. Yeah. And of course, they also need to help themselves too.
I wanted to ask you for the book that you had published, Psychology and Economics of Happiness. I wanted to ask you what you said that mental mindset rather than material availability is what is ultimately what dictates happiness. So I was wondering if you could give some time to expand.
Yeah, the idea of my book is that life is actually a very scarce and indeed the most scarce resource that we have. Each day gone is a day that's gone forever, and that's why we need to value each day as it comes and make the most out of it. Why is it related to economics? And that is because it's a scarce resource. And in order to be able to utilize this scarce resource well, then we need the wisdom, we need the attitude, we need love, wisdom, fortitude, and engagement. All of these things are very important. And
GDP of happiness.
Well, yeah, all that is a means. You see, economic means is only a means.
That's true.
The most important thing is the final goods, the final what I call mental goods, and of course we need the physical goods too in order to survive. But apart from survival, we also need people's acceptance, people's respect, and that's why bullying can kill. You see, bullying can kill when a young child is rejected by his peers and he finds that he has no friends. He's not connected to anyone. That is a potential for suicides.
Right.
And that is why we have to take these things careful, with the utmost sense of urgency.
Right.
So,
yeah, I believe that's all the time we have, Professor, but thank you so much for taking the time to speak with me on this.
Thank you.
Thanks for tuning in, and I'll see you the same time next week. Goodbye.
Bye-bye.